Have you ever noticed your gums pulling away from your teeth or experienced increased tooth sensitivity? You might be dealing with gum recession, a common dental issue that can affect your oral health. Let's dive into what gum recession is, how it can impact you, and most importantly, how you can manage it. Gum recession happens when the tissue around your teeth starts to pull back, exposing the tooth's roots. Think of it as your gums shrinking, which not only impacts how your teeth look, but can also make them more prone to cavities. The exposed roots may lead to increased sensitivity when brushing, eating, or even drinking hot or cold beverages. Gum recession can vary in severity. Sometimes it's mild and affects just one tooth, and other times it can be severe and affect multiple teeth. Gum recession doesn't discriminate by age, but it's more common in people over 65. Wondering if you're at risk? Here are a few factors that can make gum recession more likely. Periodontal disease. Gum disease is one of the leading causes of gum recession. Braces or orthodontic treatments, while they help with alignment, they can sometimes lead to gum issues. Chewing tobacco. The use of tobacco products can harm gum health. Lip or tongue piercings. These can irritate the gum tissue, causing it to recede over time. Aggressive brushing. Ironically, brushing your teeth too hard can harm your gums. Did you know that about 88% of people over the age of 65 experience gum recession in at least one tooth? It's more common than you might think, and it's not always linked to poor oral hygiene. Genetics can play a big role too. Symptoms of gum recession. How can you tell? So, how can you know if you have gum recession? Some telltale signs include exposed tooth roots. This is the most obvious symptom. You might notice that your teeth look longer than before. Pain or discomfort, especially around the gum line. Increased sensitivity. You may feel sensitivity to hot, cold, or sweet foods. Even brushing and dental cleanings can become uncomfortable. If left untreated, gum recession can lead to more serious problems like bone loss, loose teeth, or even tooth loss. If any of these symptoms sound familiar, it's time to schedule a dentist appointment. What causes gum recession? Several factors can lead to gum recession. Some of the common causes include aggressive brushing. While brushing is essential, brushing too hard can actually harm your gums. Plaque or tartar buildup. When plaque turns into tartar, it irritates the gums, which may cause them to recede. Gum disease. Periodontal disease can erode gum tissue, leading to recession, trauma, or injury. An injury to the gum tissue can cause it to pull back from the tooth. Smoking and chewing tobacco. Both of these habits are major risk factors. Tooth misalignment. Crooked teeth can create tension on the gums, leading to recession. In some cases, people with a genetic predisposition to thin gum tissue may experience gum recession even with good oral care. How is gum recession diagnosed? If you're wondering whether you have gum recession, your dentist can easily diagnose it during a routine checkup. Using a special tool called a periodontal probe, they'll measure the depth of the pockets around each tooth. Healthy gums usually have pockets between 1 to 3 millimeters deep. Larger pockets, 4 millimeters or more, can be a sign of gum disease and indicate recession. Can gums grow back? Unfortunately, once your gums recede, they don't grow back naturally. But don't worry, there are ways to manage gum recession and prevent it from getting worse. How to manage sensitivity from gum recession. If you're dealing with sensitivity due to gum recession, your dentist has several options to help you feel more comfortable. Fluoride varnish can be applied to sensitive areas to reduce discomfort. Desensitizing agents can be used both at the dental office and at home. Using desensitizing toothpaste with ingredients like potassium nitrate, stannous fluoride, arginine, or strontium chloride can help calm the nerves in your teeth over time. What are the treatment options for gum recession? When it comes to treatment, the right approach will depend on how severe the gum recession is and what caused it. There are both non-surgical and surgical options. Non-surgical treatments include topical antibiotics, which can help treat the infection if gum disease is the cause. Scaling and root planing, a deep dental cleaning, can remove bacteria that contribute to gum disease. In some cases, dental bonding can cover the exposed roots with a tooth-colored composite resin. Orthodontics such as braces might help correct tooth misalignment, which could improve your gum health over time. If non-surgical methods don't resolve the issue, your dentist may recommend gum graft surgery. During this procedure, a periodontist or gum specialist will use tissue, either from your own mouth or a donor, to cover the receding area. This is the most effective and long-lasting treatment for severe gum recession. Recovery from gum grafting surgery varies depending on how many teeth were treated and the type of graft used. On average, you can expect to feel back to normal within 2 weeks. Following your dentist's post-op instructions carefully will help ensure a smooth recovery. Can gum recession be prevented? While you can't always prevent gum recession, especially if you have a genetic predisposition, there are some steps you can take to reduce your risk. Brush gently. Use a soft bristled toothbrush and don't brush too aggressively. Floss daily. This helps keep plaque from building up along your gum line. Use mouthwash. Antimicrobial mouthwash can help fight bacteria. Don't smoke. Avoid smoking or chewing tobacco, as both are harmful to your gums. Regular dental checkups. Keep up with your cleanings and visits to the dentist to catch any issues early on. What can you expect if you have gum recession? Mild gum recession can often be managed with non-surgical treatments. In more severe cases, your dentist may refer you to a periodontist for a surgical consultation. Remember, gum recession can't be cured, but with proper care and treatment, it can be effectively managed. When should you see your dentist? If you notice that your teeth seem longer, or if you experience increased sensitivity, it's time to see your dentist. Early intervention can prevent the problem from worsening. Now that you have a better understanding of gum recession, you can take steps to protect your gums and maintain a healthy smile. For more dental tips, log on to smile-wide.co.in.